we've become much more sophisticated to not only measure in a passive sense the cavitation from a particular point, but Konstantin Kusius at the University of Oxford has developed a passive acoustic mapping system. So in a sense, he has an array listening. And when he has the array listening, the array can actually map the cavitation, passive emissions of the cavitation, analyzed by a diagnostic array, can map out the cavitation in a particular case. This is important if you're going to do therapeutic ultrasound, focused ultrasound, and you want to have a biological effect. You want to know where the cavitation is occurring in the body, and this passive acoustic mapping is a way of generating that. The lithotripters that are currently in sort of operation in the clinic typically are shockwave emitting things. It's a single shockwave that goes in and hits this kidney stone. In our laboratory at the University of Washington, the Center for Industrial and Medical Ultrasound, Adam Maxwell has said, why don't we, instead of having a single shock wave, why don't we just have a series of acoustic waves that we could break up the stone because the shock waves themselves can be quite violent. And if we lower the amplitude and have more of ultrasound pulses, then we can maybe break up the stone into smaller pieces. And these movies here, this is real kidney stones being treated by what we call burst wave lithotripsy. And so with burst wave lithotripters, you can destroy these stones very rapidly. A ordinary lithotripter firing 3,000 shocks maybe takes an hour or two to break up stones. Not every stone breaks up so well. Here's a different stone, and this one does not break. This is a synthetic stone. The upper two were actual kidney stones. But sometimes, depending upon the characteristics of the stone, they don't break up as fast. But we think burst wave lithotripsy is a new approach to lithotripsy that can break up stones faster. There is evidence that kidney stone, treatment of kidney stones with lithotripsy can cause damage to kidneys. Now, of course, you're trying to get a kidney stone can be kind of a major clinical condition that you need to treat. But we have examined the effect of shockwave lithotripsy on the stones of pigs, and on the left in a young adult, 9 weeks, and if you look at a juvenile, that is, if you were doing pediatric lithotripsy in a small child, you could have significant damage to the kidney with these lithotripters. So they have to be used with the knowledge that there may be cavitation, and cavitation may be causing damage. So sometimes we look at the mechanism through which cavitation can cause damage. So one of our students, Hong Chen, isolated blood vessels in the mesentery of a mouse. And so here are some of the blood vessels in the mesentery tissue of a mouse. And then she focused a shock wave on one of those mesentery veins or arteries and looked at, and here, and so if she put a little dye in, you can see the blood vessels themselves. Now, if you generate cavitation, after a while, if you generate shock waves, after a while it develops little bubbles. So in order for Hong to see what would happen if there were a bubble there, she supplied bubbles, and so she put in a few stabilized bubbles called contrast agents, and then she filmed this behavior of the bubble. And so here is a vessel, and there is a very difficult to see, but a bubble. And what happens if you show the movie, the one shock wave just in one cycle, causes this bubble to grow and then collapse and oscillate, just like before. So here is a stills from that bubble growing, and you can see the outline of the vessel there. And as the bubble grows, real large size, you would think that that would be the area that causes damage. Actually, it turns out that the damage has occurred as the bubble collapses and invaginates the vessel into the interior of the vessel, ripping the walls, the endothelium off the vessel, and then you can see that the vessel is leaking and bubbles are actually moving out of the vessel. And if you then look at these vessels before and afterwards, you see that this cavitation is damaging small capillaries, small vessels, and this is why you get the hematomas and the perfusion into the kidney itself. Well, so it's important to note that even near diagnostic intensities, cavitation-induced by stabilized bubbles can damage blood vessels. So this is not to be alarmist or anything. It's just showing that this is evidence that tissues can be damaged by cavitation when you have that. Now, when you have cavitation in a liquid, the reason you have cavitation is the acoustic field is acting on a bubble that's created or already pre-existing. But if the acoustic field lasts for a certain amount of time, it also heats the tissue. So Vera Koklova and Tanya Koklova have looked at when you have cavitation in a tissue, and if the field, the acoustic field, lasts longer than a few cycles, you actually can get heating and you can cause damage. Also through the fact that you heat up beyond the boiling point. And so this is a little more advanced sort of scientific study to show that we're looking at when cavitation can occur using the passive cavitation detection system to see when cavitation occurs, and then looking even for the reflection of the sound off of a exploding sort of vapor bubble. And so here's an example of the use of a passive cavitation detector to monitor what's going on. So at a low, relatively low, this is a negative pressure of 2.3 megapascals, cavitation is not occurring. But what is typical of cavitation, it has a threshold. Below a certain value, nothing happens. Above a certain value, it always happens. So when you increase the negative pressure to 2.9 megapascals, you see this noise coming out of the focus and received by the passive cavitation detector. This is for a 200 cycle pulse. And you see then that this noise coming out of oscillations of bubbles in the focus. Now, when you look at, analyze the whole mechanism, the whole cycle here, where we start out and apply a little bit more pressure, one gets a noise coming out of the field here. We see this is cavitation, and then suddenly at point, a huge amount of sound is coming out, and it turns out that this is reflected sound from a vapor bubble that is produced when the tissue is actually put into a boiling point. So let's do this in looking at now that we'll look at the spectral of the field. This doesn't show up very well, but this is in when you have cavitation noise, it is multi-spectrum. But if you look at boiling passive cavitation, it's really reflecting back. It's basically a monopolar or a monospectrum, a single spectrum. That is, you're reflecting the acoustic driving frequency off the surface of the bubble. So the point is that by using these passive cavitation detectors, passive cavitation mapping, you can determine the type of cavitation and the type of biological effect you have. So these are important in monitoring whether you have cavitation in your acoustic field.